I am Liz Powell. I am the founder of Women's Health Advocates, Breast Cancer Early Detection Coalition with some other amazing women, and G2G Consulting. I'm a lobbyist based in Washington, D.C., and we have been super active over the past year in trying to educate and advocate on breast cancer early detection and just how important that is to saving lives. You would be surprised how many lawmakers still don't understand the gaps in coverage and the need for us to change policy so that all women have access to accurate early screening. So that's always our number one priority. And we come together every second Wednesday of the month to talk about all things breast cancer early detection, breast cancer advocacy, support for breast cancer survivors, thrivers, folks touched by cancer, which is basically all of us. We are hopefully at home for you, a place to find that support and advocacy. So today, before I jump into our government updates, I am so honored to have one of our leaders speak today. So she has been active in the Breast Cancer Early Detection Coalition from day one, and has not only come to Washington to be an amazing advocate here, but she has actually made change happen in her own workplace. So she's pretty inspiring. She's got an amazing story. So what I'd love to do is to pass it over to Bethany Haskell to share her insights. And I also want to point out she is on our steering committee, so she plays a very valuable role as one of our leaders. But anyway, I want to make sure I thank you for that and cover us for serving as that leader on our steering committee. So without further ado, I'd love to pass it over to you, Bethany Haskell.
Okay. Thanks, Liz. And I want to thank you, Liz. Thank the rest of the coalition for bringing me in to share my story and how I've used advocacy. It's just been an amazing experience, learning experience to work with everybody on the coalition. So to give you a little bit of background on my story, what brought me here today, I got diagnosed with stage 1 breast cancer on November 16th, 2023. A few months prior in the summer, I had a clear mammogram. I was being followed by a breast surgeon. I had some cysts that ended up being benign. After my clear mammogram, 2 months later, I found a lump during a self-exam. I remember telling my breast surgeon it felt different than my other cysts, and she gave me the option, do you want to biopsy it, or do you want to wait until the next mammogram? It likely could be a cyst. I chose to biopsy. Unfortunately, the biopsy did confirm that it was stage 1 breast cancer. So I had a bilateral mastectomy in January of 2024. I experienced some complications, but I was able 10 months later to have breast reconstruction surgery. I would say I learned, especially if I go back to my mastectomy recovery, I learned a lot. And I was in talks with my breast surgeon, who at the time was starting a support program for people who are diagnosed when they're deciding what to do and the path that they want to take. There's a lot of questions and uncertainty. And so I hooked up with my breast surgeon and have become one of those people that are one of her support people. I would say that she puts me in contact with people who get a diagnosis and want to talk it through and want to talk through their options. So that was my first opportunity, I would say, to support. With that, after my reconstruction surgery, I had a little bit of time on my hands, I would say, on my leave. And so I was browsing LinkedIn one day. I came across Sally Wolf, one of the co-founders of the coalition, one of my favorite people now. And Sally wrote this article on Cosmo that was, why does breast cancer get such good PR? Any of you who have not seen the article, I strongly encourage you to check it out. That was how I made the connection with Sally and the Breast Cancer Early Detection Coalition. And so from there, I got in contact with Liz. I wanted to know how I could participate in the coalition. And luckily, I was very, very appreciative of my company. They actually sponsored me, Covera sponsored me to be a steering committee member on the coalition. So that's a little bit about my story, what brought me here today.
So I just posted in the chat box the article that Bethany just mentioned. I wanted to make sure
Great.
everyone can see that. It's an amazing article by Sally. So thanks for that background. I think that's super helpful for people to
Mhm.
know. Can you share more about the advocacy work that you've been involved with on Capitol Hill and what that experience was like?
Yeah, definitely. Having not done work with government before, it was definitely a new and I would say amazing learning experience for me. So last May, I got to participate. It was my first Capitol Hill Day through Women's Health Advocate. So it wasn't just focused on breast cancer, but other issues and things going on in women's health. I got to participate in a congressional briefing where, as I say, I learned so much. I think that that's an understatement. And then I got to meet with staffers of Congress people, local in Maryland, because that's where I'm based, to advocate for the Find It Early Act, which is one of the acts that we've been talking about. And I know you have some updates for us later, Liz. That was my first opportunity. I also had the opportunity in October to participate in virtual Hill meetings due to the government shutdown. Those were just shifted to virtual instead of an in-person Capitol Hill Day. So I also had the opportunity, along some other amazing women in the coalition, to advocate for several breast cancer bills. And what I'm really excited to share is I'm trying to pass on the knowledge, pass on the awareness. And so my 16-year-old daughter, who's very interested in getting involved in the work that I do, she's actually going to be joining me for the next Capitol Hill Day on May 21st. So I'm really excited to share that experience with her also.
Love that. Love,
Yeah,
love, love that. We
yeah,
love to see that you're getting applause from folks. Awesome.
yeah.
Okay, so can you share how you actually brought advocacy into your organization and this recent event that you did with Vanessa? And I think we got Vanessa up here as well, so you both can respond to this. But I think this is an awesome model for people who are dialed in today.
Yeah, definitely. And then Vanessa, definitely feel free to chime in here. So first, I would say in terms of advocacy, I don't consider it a passive approach I was taking, but there was information that I learned through, I would say, both women's health advocates, Breast Cancer Early Detection Coalition, from people on there that I would consistently share that with my team in the organization. Additionally, in 2024 and 2025, I got asked by our senior director of DE&I to champion Breast Cancer Awareness Month in October. So in year one, October 2024, I more worked with our director of DE&I and our ERG leads. Our Women's Resource Group really headed up the efforts for Breast Cancer Awareness Month to share some information, some articles, some resources. What I'm really excited to share is that this past October, when I got asked again to champion Breast Cancer Awareness Month, because I had now had some connection with Breast Cancer Early Detection Coalition, I asked three of the co-founders, so Vanessa, Leslie Yerger, and Sally Wolf, to join me in a panel discussion. So within my organization, every month the DEI team hosts what we call Coveris Community Conversations. They are various topics monthly where we bring in an external or an internal speaker to talk. And so for October, we brought in Leslie, Vanessa, and Sally into a panel discussion that I moderated. And it was focused on three areas. So it was focused on breast density awareness, which Leslie spoke to, provided some great resources, information around that, which I think it is 60, close to 60% of women are impacted by breast density in the country. We also talked about the topic of survivorship. And so Vanessa really touched upon this one around creating environments to support those who've experienced cancer and those that we care for others who have cancer. How do we help them move through their survivorship journey, right? It's not just over once, you know, we've had the tumor removed, right? We are constantly breast cancer survivors. How do we move through those, support ourselves, support others? And then Sally really spoke to thrivership. So when we think of these, what we consider to be stage 4 cancer thrivers, Sally really shared and was pretty powerful some strategies to facilitate the journey towards physical, mental well-being after navigating what are some pretty hard complexities in a breast cancer diagnosis. We had over 200 people on that call. It was recorded, and so people who couldn't attend go back to it after. I continue to get overwhelming positive feedback, people saying, I put off my mammogram. I need to go get one. I've been told I have dense breasts. I didn't know what to do with it. Similar to me, I would get it on every mammogram. You have extremely dense breasts. I don't know what to do with that. And so people are saying, now I know I need to get additional screenings or advocate even more for my health. And so continue to get overwhelming feedback on the impact that that panel discussion had. So Vanessa, I'm not sure if you want to add anything in there.
Sure. Well, first of all, it was
Yeah.
such a pleasure to be invited to come and speak with you. And of course, anytime I get to speak with Sally and Leslie is a yes, yes, yes for me because it's so much fun. Who knew that breast cancer could be so much fun, right? Um, but, one of the things I really loved about the program that you put together is, that you tailored it to your community. And I think that's a really great takeaway for anyone who might be listening right now or watching this recording and saying, how do I how do I bring this into my workplace? We don't work in healthcare. I work at a bank or, I work at an HR company or, I work for Target. I don't work for Target, but I do like Target. But you know what I mean? Like there's this idea of how do I bring this in? But the fact is that you really tapped into the reality is that women are everywhere. And women have dense breasts everywhere. And this was something that, because of your lived experience, you realized, I want to do something with this, right? We talk a lot about that idea of when treatment finishes, that sometimes that can be the most difficult time. Right? It's like you're working, working, working. You've got all these doctors, you've got all these appointments, and then all of a sudden it's over, and you're like, what do I do now? And advocacy can take all different kinds of forms, and it's not for everyone at every moment, but advocacy can really help to fill that void in many ways. It can give you a way to transform your crisis into something really constructive. And I really love how you put that together and tailored it for your community. And I hope that individuals who are considering, doing something in their own committee, that they'll just say yes to it. I mean, whether it's 20 people that show up or 200 people that show up, um, it's an easy lift, right? Um, and the ROI for the business people here is really good because it can save lives. And it is a ripple effect. So I certainly encourage anyone who's interested in getting involved and doing a program such like this to get a hold of Bethany, reach out to myself or Liz or Sally. We are happy to talk with you about creating a program, um, either virtual or in person. We actually have some in-person educational events in the works for the spring that we'll announce soon. We encourage you to reach out to us because we really want this to be widespread. Advocacy is for everyone.
Mhm.
Yeah, that's so important. Thank you for that, Vanessa. And before I ask my last question about final takeaways, Bethany,
Yeah.
I think it's important for people to know that it's not that hard to organize these. So, do you want to just add a little bit about what it felt like for you to organize this?
Yeah, and it's not that hard. And I would say, I always like that phrase, it takes a village, right?
Yeah.
Like during my diagnosis, my recovery, I was amazed by the support I got from family, friends, colleagues. And that support really carries over. And so I think what helped make it easier was the connections that I
Yeah.
had with people, right? And people really saw it's not just speaking to speak, but there's impact and value in doing these things on other people's lives, right? And I had some lived experiences, but I think it was my village and really the connection that I had in my village that helped me put something on, right? And we had a couple meetings, we figured out what are the questions we want to ask for the panel, but it's really about sharing our experiences in touching people in different ways, right? And so it wasn't a huge lift, I would say. And it's something, if you're invested in it, and I'm pretty passionate about this advocacy work I do. And I like to consider it turning lemons into lemonade, right?
Yes. Yes.
Yeah.
All right. Well, let's talk about those final takeaways you want
Awesome.
people to take with them
Yep.
today about how they can do advocacy. And also, I just want to reiterate what I'm hearing you, Vanessa, so many say, and I really want people to take with them is that you're not alone. None of us are alone. We are a community and we are here to help each other and to ensure that we really make a difference on this. So, with that, final takeaways.
Awesome. Thanks, Liz. So, four main things, right? Looking for you to take away from this. And Vanessa even mentioned this. Anybody can be an advocate in your organizations and communities. It's not just for people who work in nonprofit or in the government. Next is, I'm going to take the two next couple of things together. When you're choosing to advocate, and I looked up kind of the definition of agency, right? When we're choosing to advocate, we're not just observing the world around us or what I consider to take a passive approach, but we're really playing a direct role in influencing it. So advocacy has us taking control over our actions and knowing that those really matter, which I think helps to ground and empower us more. And so with that, it goes beyond just speaking for a cause, where it really plugs you into something bigger. And as I mentioned earlier, it helps you foster meaningful connections with others who share similar beliefs and values to your own. So I talked about the connections I have, continue to have in my organization through this work, the connections I have continue to make through Breast Cancer Early Detection Coalition and women's health advocates through this work. And it's really these meaningful connections that increase the impact that advocacy can have. The last thing that I leave everybody with is, as you heard from my story, hopefully you took, the passion for my advocacy work really drove from my own breast cancer diagnosis and my experiences. And I found that when we could use those experiences to advocate, it turns things that were really, really hard into hope, motivation, and action. And so I want to thank you, Liz. I know we have a few other things on the agenda. There was my contact information. I am happy at any time to talk through this stuff with people if you are looking to take on some advocacy work in your organization. But I just want to thank you, Liz, and the rest of the coalition for bringing me in to share my story.
Thank you. Thank you. Really appreciate that. I think that, the chat box is lighting up. You're probably not able to see all that, but you are inspiring many. And someone posted that they were on the listening side of the event that you organized. So, so we've got folks joining this organization, becoming an advocate because of your event. So that's huge. So thank you. Thank you. I'm going to quickly go through some updates on what is going on in government. So we just finished the appropriations process for FY 2026, which we're in the middle of. They just did a final deal last month where they passed all the bills except for the Homeland Security funding bill. So what I did is I went through and I looked for all the breast cancer references within these appropriation bills. Now, why did I do that? Because one thing that is certain every year, as certain as the sun comes up, they have to pass these 12 appropriation bills. Now, whether they do it individually or as a minibus, an omnibus, whatever way they do it, they absolutely have to do it every year. And sometimes, unfortunately, it's a continuing resolution, but it still is done every year. The only other bill that absolutely has to get done every year is the National Defense Authorization Act. So that's why we put a lot of focus on these, because they are going to happen every year. And a lot of policy riders and directives get included in this. And that's partly what we do at G2G with all our lobbying. So I want to make sure people are aware of some of the language, because there's actually several references to breast cancer. So real quick, this first one, breast cancer prevention and control. So this is about CDC and increasing the funding level for their program. They've got programs. They've got several programs, from Wise Women, breast cancer awareness for young women, cancer registries. They've got other cancers like colorectal cancer, comprehensive cancer control, Joanna's Law, which is focused on ovarian cancer, prostate, skin, and cancer survivorship. So these are specific call outs that CDC must plan efforts on to make sure that they're continuing to address these communities. So the breast and cervical cancer program is a key part of that. So I wanted to make sure people saw that. Next slide, please. Triple negative breast cancer. So they have called out the fact that African American women have twice the odds of being diagnosed with triple negative breast cancer. They're directing CDC to do a report on efforts to promote awareness, education, and related toolkit is included in that language. Next slide, please. Breast cancer screening evidence gaps. So this language was crafted by Congresswoman DeLauro, who, as we all know, is our champion with the Find It Early Act. And it's pretty dense, but the point is she's calling out the U.S. Preventive Services Task Force for not stating the need for supplemental screening as well as some other things, but our focus is that supplemental screening. So if you see right in the middle, the best strategy for breast cancer screening in women found to have dense breasts on a screening mammogram, such as supplemental screening. So that's what we are really focused on, but we support obviously everything here. The point is the USPSTF is saying there's not enough evidence. We all know there is enough evidence. So they're pushing on NIH to really make sure that there is no longer a gap, that it's very, very clear that we need to have access to this screening. And also point out the importance of having women of all racial and ethnic groups included in these studies. Next slide, please. Metastatic breast cancer. So they are pointing out that research is key to addressing this, that it is associated with significant disparities, with breast cancer mortality being 40% higher for Black women. And then they're encouraging continued emphasis by NCI, which is the National Cancer Institute, on research on metastatic breast cancer. And then ensuring that we have the right representation in studies, et cetera. Next slide, please. I don't want to go too long. Breast cancer diagnostic coverage. So we care about diagnostic coverage very much. So this is just encouraging that screenings and the diagnostic part of care is also covered, and encouraging CMS to evaluate the ways that, to ensure that women have access to approved diagnostic tests. And we talked about on last month's call how in Pittsburgh area, they now are covering all diagnostic screening thanks to the insurance change. So there's a positive change. And I think there's more that we can do to encourage insurance companies. And that's part of what I want to do this year. Our advocacy doesn't just happen with Capitol Hill or the state houses. It's also with insurance companies, with large employers. Like there's many ways for us to advocate, and we want to make sure we're using our voices in multiple ways. So we'll get back to that later, but next slide, please. National Breast Cervical Cancer Early Screening Program, Early Detection Program, encourages the CDC to review breast cancer risk assessment tools and publicly release a report on planning needed to create a comprehensive, publicly accessible risk assessment tool. There's been a lot of talk about that. Olivia Munn, with her story, using that risk assessment tool was key for her. So I think now government's trying to catch up to that and make sure that we're doing that. So next slide, please. Advocacy action. I love these pictures, and Vanessa does a great job of pulling all these together. So well done, Vanessa. Next slide, please. All right, so our number one priority is the Find It Early Act. So we've got DeLauro Fitzpatrick in the House, Marshall and Klobuchar in the Senate. And it's really important that this is bipartisan, Republicans and Democrats working together. We have slightly increased. So there's 49 co-sponsors in the House, there's 6 co-sponsors in the Senate. So here's where I'm going to ask all of you to pledge to join me in going after this goal. I would love to accomplish this goal by our next call, which is in exactly 1 month. Let's get 10 more co-sponsors in the House and 5 more co-sponsors in the Senate by our next call on March 11th. Can you join in this effort? Put it in the chat box. Tell me that you're going to help do this. I need to hear that I'm not alone in going after this advocacy goal. This is how we're going to execute. We're going to send letters, and you can send it using our letter. It's the very first letter when you go to send a letter on the Women's Health Advocates website. It's literally the first letter that pops up. You just put in your address. The letter comes up for you with the members of Congress. And all you need to do is add 1 to 2 sentences. And if you have already sent a letter, which I applaud you and appreciate you, just send another and personalize it by saying, I sent you a letter last year on this exact issue. I'm writing again because now we have 49 co-sponsors and we're getting momentum. I'd really love to see you co-sponsor this bill. For example, there's no problem with sending the letter numerous times. You can also call your rep and center. Maybe you sent a letter last time and this time you want to do a call, or you want to do both. Just call the switchboard. Either of these switchboards, you just call and say the name of the member of Congress that you're calling, and they will put you through. A simple message. Please co-sponsor the Find It Early Act, introduced by Congresswoman DeLauro, Congressman Fitzpatrick. If it's in the House, obviously if it's in the Senate, it would be Senator Marshall and Senator Klobuchar. It ensures all women can access accurate early breast cancer detection that saves lives and reduces overall cost of care. Up to half of all women need supplemental screening beyond a mammogram, and that's what this bill will ensure is covered. So it's a super simple message. Next slide, we've got even more in-depth talking. Oh no, these are the other bills that we are supporting. And then I've gotten the next slide, the talking points. Let's just go to the next slide so we keep moving. And this gives you additional talking points. Again, Vanessa came up with a lot of these great bullets. I just added in a few things. So the bottom right bullet, we want to plan another congressional briefing, just like we did in April last year. It was really successful. We had hundreds and hundreds dial in for that and even go and watch after the fact. So we'd like to do the same thing this April, and we'd love to have your support and engagement with that. Next slide, please. So this is how you can get involved. All right. So you can send a letter about Find It Early. You can call about Find It Early Act. You can meet with offices. You can do it in DC and in districts. And Meredith on our team and Claire on our team, they've been great at coming in, Vanessa, and doing in-person meetings. We love that. Let's just coordinate a little bit on that. You can also do meetings in the district. If you're out in Iowa, you can go meet with your member of Congress there, or their staff more likely, and just say the importance of this bill. You can help us plan or just dial into the April congressional briefing. You can create a program just like Bethany did at your job or in your community with whatever organization you're active in. It could be with your sorority, the Rotary Club, whatever entity. There are excellent ways to create educational programming, and we're here to help you. Clearly, Vanessa, Sally, Bethany, they know what they're doing. Leslie, sorry, they all can help you make sure that you have a great event. Register to vote. Primaries are happening very soon. Most primaries are in the next couple of months, although I know Massachusetts are not till September, but make sure you're registered to vote. There's been funky things going on about registering to vote, changing, scrubbing all who are registered. So just make sure you are registered correctly. Talk to public officials and candidates about the lack of coverage and what it means for women's health and beating cancer. I think a lot of folks do not understand the gap that is out there in coverage and what that means to saving lives. You can go to town halls, members of Congress, state legislators. They hold these. There'll be a lot during that April 2-week recess. You can educate and advocate anywhere. Sometimes they even do these things where they'll stand outside a grocery store just to greet anyone going into the store. Don't be shy. It's always good as a constituent to share your experience, your insights, even just a quick, do you know about the Find It Early Act? I would love for you to co-sponsor. Even that is a plug in the right direction. Post on social media. We are trying to make sure we're posting updates and information on social media. So always welcome. You can repost ours. You can post your own, tag us so we repost it. But we can definitely get active on social media. And then we always welcome donations to breast cancer early detection or women's health advocates. We definitely need to keep funding our efforts to do this advocacy. Next slide, please. We welcome joining the steering committee or our executive committee. You can do it as an individual or through your company. Either way, we welcome that. And these groups are the leadership teams that are determining the direction, where we go, how we pick our speakers, where we pick our speakers. There's some exclusive events that we do just with members of Congress. We did some great ones. December, we did a retreat and did a private lunch with the chair of the Appropriations Committee, Susan Collins. And so other activities. So leadership team at Department of Health and Human Services, which has led to further engagement and meetings that I'm doing with them as they map out their plans for the March Women's Health Conference. So lots going on and lots of ways to get involved. Wherever you are in your life, wherever you are in your journey, however you want to engage, we welcome it. Next slide, please. Special thank you to all our sponsors. Of course, none of this would be possible without our sponsors. Truly, truly appreciate all these folks. Next slide, please. And just finally, thanking you for joining this movement, making our voices count. Super, super important. You've got our websites, ways to connect with us. I think we're at a wrap. I don't see any questions in the Q&A box. And I will post the links that I mentioned in those slides. If there's no question in the next like 10 seconds, we will wrap it up. There are links there. Okay, no questions. All right. Rockstar advocates, thank you so much. We really appreciate you. Anyone who is on steering or one of the core leaders within Breast Cancer Early Detection Coalition, we've got our different link to dial into next for our call. Looking forward to seeing you. And everyone, thank you for being part of this effort. We will see you next month. Take care.